Good morning, everyone, or well, I guess good afternoon. This is Katie Novotny calling in from Premier Marketing. Today, I want to thank everybody for attending and taking a little time with us. We are so excited to have Greg Esposito of GTL here to discuss his home care product. This product is definitely one of the top sellers here at Premier. It is a product that has really made an impact on a lot of people's AEP. We're getting a lot of inquiries going on for people that are asking about home care. So we thought no better time than a little reminder of this great product that we do have here, and no one better to do it than our good friend Greg. So Greg, you ready to kick it off for us?
Ready to go. Thanks, Katie. Yeah, and thanks everybody for attending. I know it is a super busy time of the year for you, and really do appreciate you taking a little bit of time, whether it's listening to me right now or maybe listening to a recording in the next couple of days. But let's get started. We're going to talk about our short-term home health care plan. And it's just a plan that is absolutely great to have because it's something that you generally don't think about until you need it. And it doesn't really always have to be about getting up in age and not being able to do everything that you used to be able to do. It could be something that as we get a little bit older, an accident could happen, whether it's a car accident or a slip and a fall and break your hip or anything like that. There's even situations where, you need rotator cuff surgery because you slipped and fell or did something athletically and tore it. All these things can put you in a situation where home health care would be something you need. But if you can talk to your clients about it before they need it, this is a product that works extremely well, especially since it has a great prescription drug benefit, which really helps to offset most of the cost of the plan. So why don't we get started with a little bit about GTL, then we'll get into the product, and then we'll take some questions. If you're not familiar with us at GTL, we've been around for a long time. Since 1936, we are A-minus rated by AM Best, and we have zero debt on our balance sheet. What we really do is we create products just like short-term home health care, so very ancillary products in nature. And so when you are using maybe your main healthcare plan, you have some out-of-pocket costs or some specific types of healthcare plans that you might need, like a standalone cancer plan or a heart attack and stroke plan or a short-term care plan. These are the plans that GTL does a great job of creating, and policyholders not only tend to love them, but they tend to keep them for years. With regard to the plan we're talking about today, it is best in class, and it's called short-term home health care insurance, which is not the most creative name, but I think it's a good one to give you an idea what exactly it is. Something that we do like to do to help agents cross-sell it quickly, compliantly, and efficiently is create some tools for you to use at the appointment or to prospect for some sales. We have a great consumer video that I'll play for you today. We also have an infographic. Both of these can be used to get the cross sale started or even prospect for appointments with your clients. We also have all the e-app platforms that you could ever want in terms of being able to get business to GTL. So if you're going to meet with a client, you would download GTL e-app onto your tablet or your smartphone. You'd do the quote, the e-application, all on your tablet or smartphone. Your client sign your device screen and you are all done. If you're not going to be with the client and you want to sell this plan virtually, you can certainly do that. And then you'd use our PC platform, log into GTL's website, complete the application. It does not require a signature when you use the PC platform. So we have a verification call, which is about 2 minutes or less to complete when the client doesn't sign the application. So any way you're working, whether you're with the client or not, we've got a way for you to get an e-application in GTL, and they take about 5 minutes to complete. That's about it. And I'll show you a quick demo on how those work today too. So, short-term home health care. That's the name of the plan. I'm guessing you want to know what states it's actually available to sell in, and there you have it, right there on your screen. Now, we've had this plan since about 2017. So in terms of adding additional states, I do not see that coming in the future. However, you just never know. But I think after 2-3 years of having a product out, by then you pretty much have all the approvals in the states that you will get approvals. So target markets for this plan. Probably a few here that you may or may not think of. First off, if you have clients that are taking prescription drugs, this is a great plan to talk to them about. You'll find out why in just a very short minute. Also, if you have some folks who haven't thought about plans for care down the road, good plan. Also, some of them may have tried to get a long-term care plan, but they unfortunately find that they can't afford it or they can't qualify for that plan. So this plan could definitely be helpful. And over the last year, as I've been doing trainings for this, I've been hearing from some agents who do sell long-term care plans that they even like the idea of having a short-term home health care plan from GTL for their long-term care clients that already have a long-term care plan, because there are some, it takes a while sometimes for those long-term care plans to kick in. So having the short-term home health care plan can, is a great way to start off with the care. Now, here's a target market you might not have thought of. And I'm a prime example of that. I'm 57 years old, and thankfully my parents are still around, but they are 83 and 85, and they do not have any type of long-term care insurance. So who would be their long-term care plan if you had to guess? Well, that would probably be me and my wife, and both of us travel quite a bit. So if they were to start needing some care, that would mean that we had to be around some more. We would probably have to change our lifestyle quite a bit. So you have a situation where somebody like me would buy a short-term home health care plan and pay the premiums for it for my parents. So that's another target market. And the great thing is, compared to applying for and attaining a short-term health care plan from GTL compared to a long-term care plan, they're two different animals, of course, but getting this plan is very simple compared to getting a long-term care plan. And I'm going to show you the consumer video so you see what the product's about. And then after that, we'll actually qualify everybody on the call for the plan. And I'm 99.9% sure everybody would be able to get the plan. So let's take a quick look at the video.
There's no bed like your own. And if you suffer an illness or have an accident, the last thing you would want to do is recover in an unfamiliar, hectic environment like a hospital or nursing home. Focus on your recovery in the comfort of your own home with short-term home health care insurance from Guarantee Trust Life Insurance Company. Think about your family situation. You may be reaching that age where planning for future care is necessary, or maybe your parents are reminding you they don't want to go to a nursing home. How could being unprepared for either yours or your parents' need for care affect your finances and way of life? GTL's short-term home health care insurance is more affordable than most other plan of care policies, and it pays benefits directly to you regardless of any other insurance you have. Home health care benefits kick in if you suffer a cognitive disability or can't perform 2 of the 6 ADLs, and no hospital stay is required. The base plan consists of 3 main components, and there are 3 different base plans for you to choose from to match the level of coverage you want. With the home health care benefit, your chosen plan pays a benefit for up to 360 payments for a variety of services, including skilled nursing, physical therapy, and general nursing care. With our most comprehensive plan, you can receive up to $162,000 of home health care benefits. With the home health care aide benefit, you can receive a daily benefit for each day you require the services of a home health care aide, depending on your chosen plan, and no hospitalization stay is required. Most likely, you're taking at least 1 prescription medication. With the prescription drug benefit, you can receive benefits for any prescriptions that are filled after the policy is in effect. Just filling your normal prescriptions can help offset the cost of the policy itself. Now let's see how it works. Say you're 65 years old, have the Plan A policy, and take one brand name prescription that you refilled 10 times over the year. A GTL short-term home health care insurance policy would pay you a total benefit amount of $250 over those 12 months. With an annual policy premium of $294.45, the net cost of the policy would be less than $4 a month. And this is not even including any home health care benefits you may receive. Policyholders can also have access to Ask Mayo Clinic services 24 hours a day. Receive personalized support and trusted medical guidance for your health-related questions from the experts at Mayo Clinic. Short-term home health care insurance from GTL is flexible and customizable, with a great set of riders for you to choose from. And with only 2 or 3 underwriting questions, you don't have to worry about a long application process or medical exam. So, for a fair premium, wouldn't you rather receive professional care at home? Now is a great time to find out more about GTL's short-term home health care insurance.
There you go, a nice little video. And again, that's our consumer cross-selling video. So you have some opportunities here in front of you to use it many different ways. You could send out an email to a client with that video link in it. You could put that link on social media. You could put it on your website. And of course, you can use it during an appointment talking about another product where you feel like this would be a great cross-sell for the client. Speaking of another cross-selling piece, what's on your screen right now is an infographic. It's one page. You can see the front and back of it. Specifically, if you look at the page on the right, you'll see that there's an area for you to put a stamp or sticker with your contact information. This is another piece that you could throw in the mail as a prospecting piece, or use it in place of the video to kind of explain, walk through the product, if you will, with the client. Now, if you have some questions today, feel free to type them into the Q&A section. We'll tackle them at the end of the demo. All right, so as promised, we want to go ahead and qualify everybody for the plan. After watching the video, you know that there's 3 plans to choose from, Plan A, B, and C. If you're going to apply for Plan A or B, you only have to answer the first 2 application questions. And if you answer them both no, guess what? You get the coverage. So let's do that. The first one is, are you currently in a nursing home, assisted living facility, or getting home health care or similar benefits? If you can answer that no, you're halfway home. Second one, I'm just going to paraphrase. Do you already have trouble doing your activities of daily living, ADLs, or been diagnosed with a cognitive impairment? Well, if you can answer that question no, along with the first one, you can have Plan A or B. That is it. If you want to apply for Plan C, you also have to answer the third question no. So in terms of attaining this coverage, now you can see why I was saying 99.9% of the people, they should be able to get this. So with regard to the plan, the issue age is 61 to 85. And once you have the plan, you can keep it. So it doesn't go away at any time. All right, so Plan A, Plan B, Plan C, whichever one you choose, you get all 3 components, which are the prescription drug component, home healthcare component, and home healthcare aid component. So one thing I want to do, it's always just a quick reminder for me to make sure to tell you this. I threw all the coverage on the screen here at once, all 3 components. That just reminds me to tell you that if you choose Plan A, you will automatically get Plan A for home health care aid, and prescription drugs. So you cannot mix and match the component plans. You're going to get all A, all B, or all C. So let's break them down and get into each one individually. The prescription drug component, this is the one that is super interesting and makes this plan very affordable for the clients. Think of it this way. The minute that your coverage is approved, you can start getting $10 every time you refill a generic prescription, or $25 every time you refill a brand name prescription. And the most you can get each year is up to $300 if you have Plan A, and up to $600 per year if you have Plan B or C. So your clients, they're probably already taking some prescriptions. Once they get this plan and it goes into force, any prescriptions they fill after that, they can start getting money from GTL. So that's a great way. When you start seeing the cost of this plan, you'll be like, wow, the amount of money that they can get back on prescriptions almost pays for the whole plan each year. So now is a great time for me to tell you something that you may be wondering. We have this plan since 2017. When you see this prescription drug benefit and then you see the premiums for it, you may start wondering, is this plan going to be around? Seems like it's really inexpensive. So happy to tell you that having this plan for close to 4 years now, the plan is performing extremely well for policyholders, for GTL, and the agents. So even though you'll see the pricing and you see this prescription drug benefit, it's performing extremely well. Okay, so give you a quick example. Let's say that I'm 65 years old, I have Plan A, and over the first 12 months of my policy, I filled 15 prescriptions. 5 are brand name, 10 are generic. So when we do the math on that, that turns out to be $225 that I will get from GTL just for refilling my normal prescriptions. So my policy premium for a 65-year-old Plan A is $294.45 a year. So when you do the math on that, I paid $294 to GTL. I got $225 back in prescription benefits. So this plan really cost me $5.79 per month. And that doesn't even include all of the benefits that I could have used this for home health care and home health care aid, which we're going to get into next. Now, before I do that, let me answer a couple FAQs that I usually get on the prescription drug component. So the first off is you might be wondering, you're saying, well, Greg, with this plan, if you take one brand name prescription and you get it refilled every month, are you saying that GTL is going to send me $25 each month? Well, that is true. You will get that until you hit your annual maximum for the year, which is $300 for Plan A or $600 per year for Plan B or C. Now, it's the same way for generics, except it's $10 each time you refill a prescription. This is one that is very important. So that's why we made a whole slide about it, because we do have a lot of folks that are on a 90-day supply or 3-month supply. And you may be wondering, when they refill that 90-day supply, are they going to get one benefit or are they going to get 3? And the answer is 1. And the way this program is designed, every time you refill a prescription and get a prescription receipt, that's a benefit. So as you read the coverage and look into this, just keep in mind for your folks that are on a 90-day supply, when they refill that 90-day supply, that's 1 benefit. And here's the most popular question we get. What happens if my client's on Medicare Part D, or when they go into the drugstore, they're using GoodRx and that discount app, and they literally pay nothing for the prescription, or they pay $2.50 for it, or $5. Are you still going to send $25 or $10 to the client? Yes. So this plan is an indemnity-based plan. So all the coverage we talk about today, we are going to pay based upon the coverage the client has, regardless of any other coverage that they have elsewhere. And that is the prescription drug benefit. Now, the home health care benefit, that's the second component. This is one where something does have to happen to the client after policy issue, and that something would be either developing a cognitive impairment or a functional impairment. Now, the functional impairment we're going to define as being unable to do at least 2 of the 6 activities of daily living. And that could be either or, and then when they need home health care, this is the coverage that will be there for them. So before I get into all the different levels of care, you may be wondering, how long does this last? Well, the home health care portion lasts for 360 days of coverage. Now, the important thing to know is that 360 days of coverage has nothing to do with the calendar year. So if I need home health care and I only need it 1 day a week, it will take me 360 weeks to go through this coverage. If I need it 5 days a week, obviously I would go through those 360 days faster. But I just want to stress that it's not like I went on home health care starting today and now I only have 359 days left. No, you've got as much time as needed to use it, nothing to do with the calendar year. Now, in most states, we do have a restoration feature for the plan. I'll explain it to you really quickly. If you use up your 360 days, or you use up some of those days, and then you recover fully, meaning your doctor says you don't need home health care anymore. After you have 180 consecutive days of that, the plan restores. Now, it will not restore if you have something, you're using it, use up all the 360 days, and you do not recover fully. So think of it this way. Maybe I fell and broke my hip. Most likely I'm going to need some home health care. I'm going to recover. And then after I'm recovered for 180 consecutive days, I get a brand new 360 days of benefits. If I have dementia, unfortunately, we don't have a cure for that, and I'm using home health care because of that. Probably once I use my 360 days, unless they find a cure in the future, I'm not going to be fully recovered. So I would not see a restoration of these benefits. So here's how they work. Let's just say that I have Plan A. With Plan A, I have all of these different types of coverages, and you can see, depending upon what plan you have, you can get a certain dollar benefit each day. And the most I can get each day for Plan A is a total of $150. So if I took $150 times 360 days of coverage, that's $54,000 of home health care that I could max out before any restoration. If I have Plan B, I can get up to $300 per day. $300 times 360 days, $108,000 of home health care benefits. And Plan C, $450 per day is the maximum. Do the math there, you end up with $162,000 of home health care benefits. So when I look at this plan, I say, wow, even without a restoration of benefits, there's still a lot of benefits here to be had, especially when I look at the premium. Then I'm getting my prescription drug benefits too. Wow, a lot of coverage here. So let's just run through a quick example here. Let's stick with the idea that I'm 65 years of age. I have Plan A. Unfortunately, I have a stroke, and now I need some home health care. And specifically, I need some speech therapy and some physical therapy. And let's just say that in order to max out my Plan A, which is up to $150 per day, I want to have my physical therapy and my speech therapy done on the same day, so I can max that out. So after 10 days, I would have $1,500 of benefits coming to me from GTO. Now, again, my annual policy premium for a 65-year-old with Plan A is $294.45. Very inexpensive. So let's get to the third component, which is home healthcare aid. Now, I'll just say, generically speaking, the home healthcare aid is coming over to the house to help with those ADLs. Now, that can be defined better by the doctor who's filling out the plan of care, but just in terms of trying to be generic and explaining what the difference is between home healthcare and home healthcare aid, usually the aid is helping with the ADLs. So what do we have here? Well, with Plan A, you can get $40 per day. Plan B, $80. Plan C, $120 per day. Now, one of the nice benefits with the GTL plan is you do not have to have a prior hospitalization in order to start using these benefits. And you might be wondering, well, how long do they last? 60 days. And importantly, again, those 60 days have nothing to do with the calendar year. As long as it takes you to use them, that's how long it takes you to use them. The same restoration feature that we talked about on home health care is the same for home health care aid. You use some or all of those 60 days, you recover for 180 days, you get a new amount of 60 days. If you're using this, you never recover, it does not restore. Very simple. So when we look at the max you can get on this, Plan A, $2,400, $4,800 for B, $7,200 for C. Again, a good chunk of money that you won't have to take out of your bank account if you have this plan. So this is always a question that we get. And when I started talking about this, I started thinking to myself, wow, that's a lot to say. That's a lot to read. So let me break it down for you very simply as to who can provide the care. This is much easier, right? So the caregiver has to be registered or certified in their state to perform the services, whether it's home health care or home health care aid. And they need to work for a licensed agency that can provide a bill of service and the details of each visit. So very simple, straightforward. So with this plan, this is not going to be a situation where the spouse, a friend, a neighbor, a relative is providing home health care or home health care aid services and you're using this GTL coverage for it. Unless they happen to be registered to perform those in their state and licensed with an agency that can give us a bill and the details of each visit. Now, very important, a lot of agents say, well, I play the video for people and they sign me up. But it's really important to let them know that this plan does have a 6-month pre-existing condition limitation. And what better way for me to explain it to you than by give you an actual example that happened to me with an agent. So back in 2017, we launched the plan. An agent called me probably after 3-4 weeks and said, you know what, I bought this plan for my husband, and unfortunately, he's been being treated for cancer for the last 2 years. So she said, could you explain to me how the 6-month pre-X will work for him? So sure, let's do that. So basically, the person has cancer when they applied for coverage. So how does this 6-month pre-X work? Well, if the client starts needing home health care or home health care aid services due to his cancer, he cannot use it until the policy is over 6 months old. Simple. That's the 6-month pre-X. However, let's just say that same person who's being treated for cancer gets the policy, and a week after they get it or a day after they get it, they fall and break their hip. Well, that's not a pre-existing condition. So they could use this coverage right away if they needed home health care or home health care aid services due to falling and breaking their hip. So that's how the pre-X works. It's very simple. So let's see how much this costs. And keep in mind when we're talking about this that the prescription drug component is included here, and you can get up to $300 per year if you have Plan A, up to $600 for Plan B or C. So if I'm 65, I want Plan A, it will cost me $24.54 per month. If I keep the plan, when I turn 71 and the policy hits its anniversary date, then my premiums will increase to $32.85 per month. Years down the road, when I turn 76 and my policy hits its anniversary date, $43.48 will be my new premium. So this is the only GTL plan that we currently have where when you buy it, the rate does not remain level forever. So with this plan, it's very important to let your clients know when they buy it, based upon the schedule you see here on your screen, the rate will increase every few years, and it's scheduled to do so. So it's not that there's anything wrong with the product or it's not working well. These are the rates, they will change as the client goes into the next age range band, and it takes effect when their policy hits the anniversary date. So you can imagine if I'm 70 years old or 75 years old or anywhere close to the next age range band, it's really important to let the client know they will see normal increases every few years so that they're not thinking anything's weird or the product, they didn't realize it was going to go up in price. Okay, so the last rate increase is at age 86. And again, you can keep this plan as long as you like. Just with all the GTL products, you can pay via monthly bank draft, and you could also draft for any other mode. Direct bill currently is a little bit more of a hassle because we do require a paper application with the premium to come in with that paper application. So if your clients are doing bank draft, whatever mode, you're never collecting any money, it's super easy for them. So I'm sure you have been wondering how easy it is to get the prescription drug claims. Well, it's super easy to get those claim benefits. All you have to do is you take your prescription receipt that comes with your prescription, the one with your name on it, the drug name, how many pills are in it, the directions on it. Yeah, just take that receipt, put your GTL policy number on it, throw it in an envelope to GTL, and that's it. So there's no claim form that needs to be filled out for the prescription drug receipts. The clients can turn them in as often as they like. Some people do it monthly, some people do it annually. The people that do it annually actually usually go to the drugstore and ask the pharmacist to just print out their prescriptions for the year on a piece of paper. So they don't even have to mess around with their prescription receipts. That works too. But really, we've got folks who every time they go to Walgreens and pick up a prescription, they send it to us. And then we have others that just kind of do it in bulk every so often. Whatever works for the clients works for us. So with regard to going on claim for home health care or home health care aid, very short claim form, a plan of care, which is always filled out by the physician anyway to basically tell what type of care they need. It would say something like, Greg will need home health care 3 days a week for this, this, and this. That gets included with the claim form. And then also the first bills for the home health care or home health care aid services. That's what we need in order to get the claim going. Now, let's say next month you're still on claim for home health care or home health care aid or both. We don't need another claim form. We don't need another plan of care. You just send us the next month of bills. So that's the claim process for home health care aid. Now, if you happen to pick up some of the other riders that I'll mention to you in a couple of minutes, same thing, short claim form, send us the bill. That's how the claim process works at GTL. So that's the product, and I want to mention to you a couple other riders that come with it. And especially if you're an agent that's been selling our hospital indemnity plan for years, sometimes you're just like, wow, my clients need a hospital indemnity plan, but unfortunately, they may have one of the few conditions or be in a situation where they just can't get our standalone hospital indemnity plan. So we've already looked at the application questions for the short-term home health care plan, and we know that it did not ask anything about if we have diabetes or COPD or a surgery coming up or have been in the hospital recently. So we know that we can probably get that client who you want to have a hospital indemnity plan but cannot qualify for our standalone one. You could probably get them this hospital indemnity rider. So how does it work? Well, you get a 3-day or 6-day benefit period, whatever you choose. These benefit periods restore unlimited amount of time after 60 days of no use, just like our standalone hospital indemnity plan. You can choose from a benefit of $100 per day, $200 or $300 per day, depending upon which plan you get. And the nice thing is these benefit periods restore an unlimited amount of times after 60 days of no use. Very similar to our standalone hospital indemnity plan. So what else do we need to know about the rider? Well, there is a 30-day wait for sickness hospitalizations, no wait for accidental hospitalizations, and this is the big one, our standalone hospital indemnity plan called Advantage Plus. Once you buy that plan, the rates remain the same as you get older. With the hospital indemnity rider on the short-term home health care plan, rates will increase based upon the same schedule that I just showed you for the home health care plan. So every 4 or 5 years, the rates would increase. Now that said, that's why I always say if your client needs hospital indemnity coverage, get them the standalone plan. If they can't qualify for it and they need some short-term home health care coverage, well, now you can do both. Get them the short-term home health care plan and the hospital indemnity rider to it. And it has the same 6-month pre-ex that I explained for the home health care and the home health care aid. So when you're doing business with GTL, obviously we would accept paper applications. Those are either faxed or scanned emailed right to GTL's underwriting. We have our GTL e-app platform, super simple to use. That's what I recommend if you're with the client. And then we have the PC platform. If you're not with the client, you can do the app for them. There's nowhere for them to sign. So what we do in place of the signature with the PC platform, we have a very short verification call that they can complete. There's no medical questions, just basically asking them a few questions to verify their identity and that they want to purchase the product. So let me show you a quick video on how the e-app platform works and how easy it is to use. It's so simple to use, we very rarely do demos on it because it's just so easy to use. All right, so here's the funnest thing I can tell you about all the GTL platforms. Once you click submit, our system will issue the business in about 5 minutes or less. And once that happens, we send an email to you and we send an email to the client thanking them for the coverage and letting them know their coverage has been issued and what their policy number is. Another thing we do is with that email, we also deliver any delivery requirements to the client via PDF. So it's kind of fun. If you're meeting with the client, you probably won't make it to your car before they get an email and you get an email that their coverage has been approved. And if you're doing virtually, you probably won't be off the phone with them for more than a minute or two before they get that email that the coverage is approved and ready to go. So I wanted to point out to you that the folks at Premier are awesome, which we all know already, and they know about this product inside and out. So if you're looking to get contacted, if you're not already, you definitely want to do that through Premier. And if you have some questions on the product, I know Katie and her staff, they know all about it. But, you know, GTL sales support we've got a lot of information too and can help you with some other things too. So if you need some supplies, have some questions on the plan, have some questions on the EAP platform, anything like that, you can always reach out to sales support at 800-323-6907 or agency at gtlic.com. Something that's new is we do have a little text chat going on during normal business hours, and you would use the same number as sales support. So the 800-323-6907, you could, put that in the text field and text one of the sales support reps for a quick answer on something too. So keep that in mind. And with that, Katie, why don't we take a look and see if we have some questions we can play Stump the GTL Sales Manager if you like.
Perfect. Thanks so much, Greg, for all your help on this one. I do actually have a couple questions. First and
Sure.
foremost, do you consider this product to be a reimbursement plan?
Well, the first thing, we just kind of say it's a indemnity plan, and we, just like all GTL products, we pay based upon coverage that we issue. So, at no point in the application process or throughout the whole underwriting process do we know what type of coverage the client has, what their copays are, let's say for their prescriptions. We have no idea. So we just basically, for prescriptions, we get the receipt, we pay them $25 if it's brand name, 10 if it's generic. That's it there. And with the other situations, if somebody's getting Plan A and they need some physical therapy, that's going to be $75. Whether or not their copay is actually $75 or higher or lower, we don't know. We're just going to pay based upon the coverage. So, that's kind of how I look at it. The situation could be one where the client is getting more money from GTL back than their actual out-of-pocket for that home health care, or, it could be less. It just depends on the situation.
Perfect. Another one says, if Medicare is paying for home health care, can you still get reimbursed?
Yeah, absolutely you can. Basically what you're looking at are a couple things here. One, you have to have the product. Two, you have to be able to submit the bill to GTL. And it's not the amount of money that they owe that we're looking at. We're just looking to be able to verify that they got the services, and then we can pay them the benefits that they signed up for GTL.
Perfect. Another one says that if you would buy a policy and move to a different state for retirement, is this coverage portable?
Yeah, absolutely. Absolutely. So it's always going to be issued out of your resident state that from when you applied. But as you move to a different state, it doesn't matter. It's all good. All good. Anywhere in the United States.
Another question is, your application asks a height, weight, but is there a bill chart?
Actually, there's not. So the e-application will ask for a height and weight, and it's just something that our actuaries track, but it has nothing to do with getting the coverage or not getting the coverage.
Perfect. Two more I see here. If anybody else has anything, please feel free to type it in here. Another one says that can you own more than one of these policies, or can you buy another one if you would exhaust the first one?
All right, so we'll tackle those at once. So the most coverage you can have is the maximum amount of coverage. So the maximum amount that you can get with Plan C is the most that you can have. So could you buy 2 Plan A's? Well, that doesn't work really either because you got the prescription drug benefit. So, basically you can max out the coverage by getting like 1 policy and maxing out the coverage, let's say Plan C. You can't buy 2. The second question is, once you do exhaust the coverage, could you just buy another one? Well, I would say no on that. I can't give that a solid no, because basically you would have to apply again. You would have to be able to answer those underwriting application questions no. In most cases, if you exhausted the coverage and were still getting home health care and you had a need for it, you wouldn't be able to attain the coverage. But I guess you could have somebody who bought it, maybe broke their hip or something like that, exhausted the coverage, ended their coverage, and then decided later on when they were totally healthy they wanted to apply again. Well, in that situation, they most likely would be able to, as long as they can answer those application questions no again.
Perfect. Another one says, can you explain the payment process for home health care? Does one have to pay the agency first, or will they accept payment directly from GTL?
Good question there. So basically, in most instances, the policyholder's filling the claim form, sending it to GTL, and we're going to cut a check to the policyholder directly. Now, with our hospital indemnity plan, sometimes, when they're checking into the hospital, if they're giving their GTL coverage, ID number, policy number, their ID card, and then they're signing in, they're kind of assigning their benefits. So with the hospital indemnity plan, sometimes we do get the claim form from the actual services that doing it. And in that case, we will pay them directly if they did assign their benefits. But for short-term home health care, you say it's probably 99% of them that we're sending the check directly to the policyholder. Because again, they're not in a facility like a hospital for a hospital indemnity plan. They're at home getting home health care. So, that's generally how it works.
Right. A couple more that have come in. Are the rates the same throughout the country?
I am 99% sure that the rates are the same throughout the country. I'm trying to remember off the top of my head if we have one state that may be a little bit different. Something's telling me that in one state we have rates that may be a little different. But yeah, pretty much across the board, they're the same rates for all states. We have a couple states like Kentucky that didn't allow us to have this or didn't allow us to have the prescription drug benefit. And that one, the rates are a little bit different because of it. But yeah, basically it's pretty much the same state from state.
Another one says, do you need to be licensed in every state in order to do business?
Okay, good question there. So obviously you're going to have your resident license from the state you're in, but if you have a non-res in the other states that you're selling in, that works fine.
Perfect. Well, I don't think we stumped you today.
I don't know.
We appreciate all the questions that came in. These were great. This is makes for a great discussion afterwards. Yes. Well, everyone, I appreciate you guys taking the time to join us today. And as always, Greg, thank you so very much. Well, I appreciate you guys all taking the time. And we here at Premier are more than happy to continue any conversations that you would like to. And if I don't know the answer, I'm sure Greg would be happy to join us as well.
Absolutely. Thanks, everybody. You guys have a great rest of the week. Have fun. And we're here if you need us. And obviously, Premier's there too. So you guys are all in great hands.
All righty. Thanks, everyone. Have a great day. Goodbye.
Take care.